Dear healthcare professionals, in this video I am going to share with you fifth case in the series on diagnosis. The series of interesting, uncommon, and challenging cases which I came across during my clinical practice while working in critical care. Videos are helpful for all healthcare professionals. I will share a real case that was presented to our hospital's emergency. In this case, the simple omission of not identifying underlying cause would have led to incomplete treatment, therefore possibility of poorer outcome and likely mortality. I will walk through real scenarios so you can connect this story with real-life clinical situations. So, let's embark on this story of making the uncommon, interesting, and challenging diagnosis and how it impacted the patient's management and the outcome. Let's begin with our case. A 44-year-old woman presented to hospital emergency in severe abdominal pain. Abdominal pain was started a day before presentation and the pain was getting worse. She also had vomiting multiple times. There was no past history of diabetes, hypertension, heart disease, stroke, seizure. Her previous reports conducted few months ago revealed the presence of thrombocytopenia. On presentation to emergency department, she was conscious with sinus tachycardia. Her heart rate was 120 per minute regular, blood pressure 110/80 mmHg, respiratory rate 22 per minute and normal temperature. Her abdomen was distended and tender. She was admitted under internal medicine and shifted to intensive care unit where resuscitation and evaluation was ongoing. In view of rapidly worsening condition, it was decided to proceed with surgical intervention by surgeon as the likely cause was intestinal obstruction. She was confirmed to have intestinal obstruction with small intestine gangrene as operative findings. Gangrenous portion resected and ostomy created, and patient was transferred under surgeon and shifted back to intensive care unit after surgery. So, what was the diagnosis of this patient? Small intestinal gangrene causing intestinal obstruction. ICU team continued to evaluate patient, while continuing with treatment, for the underlying cause of intestinal gangrene and did CT angiography which revealed the presence of superior mesenteric venous thrombosis. Now the diagnosis was more apparent. Superior mesenteric venous thrombosis leading to small intestinal gangrene. We initiated the patient on therapeutic dose of low molecular weight heparin. Now new question emerged. Why superior mesenteric venous thrombosis? We need to identify what leads to superior mesenteric venous thrombosis. We continued to evaluate patient for the underlying cause, and it turned out to be systemic lupus erythematosus with secondary antiphospholipid antibody syndrome as suggested by positive ANA, positive lupus anticoagulant, and high APTT value. So, what could have been possible if we discharged the patient after surgery without establishing an underlying etiology? Not knowing the underlying cause could have led to recurrent thrombosis causing strokes, heart attacks, pulmonary embolism, mesenteric thrombosis, and organ involvement. By establishing the underlying cause of intestinal gangrene, hence, by establishing the correct diagnosis, we were able to prevent likely morbidity and mortality. So, diagnosis of this patient was not intestinal obstruction or gangrene but systemic lupus erythematosus with secondary antiphospholipid antibody syndrome. Gangrene was a finding and pain abdomen was a presentation. As the diagnosis became apparent, we added anticoagulant drug warfarin and immunosuppressive medication for systemic lupus erythematosus. So, diagnosis was helpful in optimizing long-term treatment. So, establishing an underlying diagnosis is an essential component of treating patients. Healthcare professionals should be cognizant of the difference between diagnosis, findings, and presentation. Misdiagnosis or no diagnosis can lead to incorrect treatment, complications, and potential morbidity and mortality. Hope this was an interesting case. If you like this information, please subscribe to this channel for more interesting and challenging diagnosis.